Hello, I'm Mick Jagger if the Rolling Stones were around today and if he wasn't old. So what we're going to be talking about today is assisting with it, administering a cleansing enema. First things first, going through opening protocols. So verifying orders, gathering supplies, performing hand hygiene, providing for patient privacy, introducing yourself to a patient, identifying your patient using two identifiers. This is bread and butter at this point. You're also going to be noting what type of enema they need and what type of enema is being administered and ordered. You're going to compare the record of that to previous enemas that they've had done. You are then going to be helping them into an appropriate position. So you're going to encourage them to remain there in that appropriate position until the procedure is over. So generally that's going to be a left side lying Sims position, which we have talked about in previous videos. After all that's done, I'm going to be applying clean gloves. At this point, my hands should be scrubbed clean. They should be good to go before I even enter the room. If they're not, do so again. Then I'm going to be administering a prepackaged disposable enema. We're going to be talking through that first. So, you're going to be removing your plastic cap from your container. You're going to be applying a water-soluble lubricant. You're going to separate their buttocks, and you're going to examine that region around their buttocks for any signs of redness, swelling, irritation, inflammation, anything that looks like the skin is not in the best shape. You're going to want to make sure of that to start off with. You're going to then instruct them to relax. They want to breathe deeply. They want to breathe evenly. They want to take just, that's a good way for them to freak themselves out. So just those types of breaths are really good. You're going to then expel any air that is present in that enema container. Make sure it's just completely free of air. You don't want any bubbles going in. You're then going to insert the lubricated tip gently but firmly into the patient's anal canal. You're going to adjust the insertion depth based on their age. If they're older, it's going to be a different depth than when they're younger. You may want to make sure to not force that tip in, though. It's really important to make sure to stop the procedure if resistance is encountered. You're then going to want to roll the bottle from bottom to tip until all solution has entered the anus. Then you're going to place toilet tissue, or toilet paper as we call it, again, Rolling Stones, around the rectal tube and the anus to catch any kind of dripping or just general outpour. You're then going to remove the tip of the enema tubing and dispose of it. You're then going to instruct the patient to retain that solution until the urge to defecate has occurred. And then if we're talking about a standard enema bag versus a disposable one, you're going to add warm solution to the bag if needed, or if ordered. You're going to then check the temperature via your wrist because your hands are super sensitive to temperature, but your wrist is a little bit less so. You're then going to apply some soap to the water if ordered. You're then going to raise the container, you're going to release that clamp, and you're going to allow solution to fill the tubing. After that tubing is done, you're going to reclamp that tubing. You're going to position and drape the patient accordingly and properly. You're then going to make sure to use a lot of lubricating gel. You're going to separate their buttocks. You're then going to instruct the patient to relax. Again, those deep, even breaths, that remains the same whether or not it's disposable. You're then going to instruct them to also breathe through their mouth, those deep breaths. Again, very important. You're then going to touch their skin next to the anus with the tip of the tube to make sure they are used to that sensation. You're then going to insert that tip very slowly. Can't insert it slowly enough. You're going to adjust the insertion length again based on age. You're then going to open that retaining clamp and allow the fluid that is currently residing in the tubing to flood into the anal cavity. You're then going to keep the container level at the patient's hips. You're going to hold that tube in place constantly, and you're going to raise the height of that container constantly, but slowly. After that enema is administered, you're going to remove and discard your gloves. You're going to perform hand hygiene. You're then going to raise the side rails. You're going to lower the height of the bed. You're going to make sure that the patient is then comfortable. You're going to place personal items within reach. You're going to make sure that they are good to go in terms of needs, and they're going to call light. Make sure the call light is within reach. Make sure they know how to use that call light. And then you're also going to document everything that you did. So document the type of enema bag used, not document the response to the enema, document type and volume of the enema. I keep saying enema, and enema is correct. I'm not sure why I'm double checking myself. At the time of admin and the characteristics of the stool after they've defecated. That's one thing I forgot to mention. You want to make sure to let them defecate and give them the opportunity to defecate after they've had this enema administered. It could be uncomfortable for them to retain it for long periods of time.